Hi, everyone. Just going to go over some of the numbers. Provincially, the numbers are at 590 today. They were in the 400 yesterday, but they're going down provincially. We're seeing the trends in Toronto as well, the GTA area. Ottawa had 25, and we've had really quite a good week in terms of our numbers. I'm just going to explain some of the discrepancies that we saw on our data that we were corrected right now. We're actually now at a total of 12 cases in overall. We have not added any cases today. Cases remain the same. So this is the last accurate number that we have of our number of cases going on. In terms of our rolling average, again, you could see very nicely we're down. We're actually below 5, which is very, very good, and we'd like to stay there. Just want to give you just a couple of updates in terms of what happened. It seems that with the filter that we're using, the CCM actually counted some other aspects of some of the data that's on and miscalculated as active cases. And so when we went to notice that, some of our nurses noticed that our active cases were really up and didn't make sense with the number of cases that we're actually reporting. So that's why there was an over estimation of the active cases. So we had to make that correction. And so right now, this is the corrected version. This is 12 active cases with total of that number. And so now when we do a search in the CCM, we ensure that we put a specific filter in it to ensure that it doesn't mix up some other data that is misinterpreted by CCM as active cases. In any case, this is where we are now. We've got 12 cases, and in terms of to me, what the important thing is the trends, and we're really low in terms of numbers, and you saw there in our rolling averages as well. And if you look at our map, again, virtually most of our most of our areas municipalities have, 0 or a couple of cases, active cases, which is a stark difference from what we had literally about a month and a half ago. So this is excellent, and we're quite pleased to see that. And in addition to that, we're actually also going to obviously be going into step 1. I think the parameters are there for step 1. And by the way, hospitalizations are down. We have 4 active, 3 of which are in the ICU, one of which is actually getting better in the ICU. So that's good news. And we're seeing the same provincially. We're seeing a provincial slow decrease in hospitalizations, slow decrease in the percent positivity, and all these things as well. And so moving forward, where I'm comfortable at this point, because we've also achieved the vaccination rates that were required for step 1. And as you know, step 1 will start tomorrow in part of the reopening, sort of the map to the road to recovery. And so as of tomorrow, we will have gatherings of 10, maximum of 10 from different households, outdoors only, obviously, no indoor gatherings. There is going to be, the restaurants are going to be open for patio only, but 4 per table. There's also going to be some limited outdoor sort of activities like botanical gardens, those type of things. And also in terms of retail, again, just to summarize, there is going to be the essential retail capacity inside is going to be 25% of capacity. And for non-essential retail that has been closed up until now, they will reopen with 15% capacity, indoor capacity. Places of worship and rites, ceremonies and those type of things, religious ceremonies, weddings, funerals, and so on, 15% capacity indoor. Outdoor, it would be based on the percentage of people that can be aggregated in a certain area based on 2-meter distancing. I want to also clarify that this does not include wedding receptions or parties or anything like that. This is only the religious ceremony itself that can occur in a religious setting under those circumstances. So we need, again, slow approach moving forward. And again, and actually the other thing too is pools, wading pools, beaches, everything that's going to be open over the starting tomorrow as well. And it's just, again, important to make sure that we still adhere to the physical distancing and those things as well. So and stay tuned. We will have some, I believe, over the next week or two, some more details as to step two. As you know, step two will then have more gatherings on the outdoor gatherings. They'll allow some indoor gatherings as well, likely. There's also going to be the opening of personal service settings, water parks, amusement parks, a whole slew of other activities. Again, mostly outdoor and a few indoor with some restrictions, obviously. So stay tuned. But now I think people are going to have a bit of an opportunity to get this. But again, slow opening, slow is the best approach for us to go. So now I just want to talk a bit about vaccines, and actually the rest will be about vaccines. Delighted to see our numbers here. I'm just going to share once again our area here, and as of if you look at our numbers as of today, we're over 131,000 vaccines. Again, most of which are first dose, and that is about a 78.6% of our adult population. If you calculate it based on 12 plus, we're about 74%, and so that's good moving forward. I did get some questions as to what our target is in terms of numbers of individuals. Oh, I can tell you that we have a total of 180,000 individuals over the age of 12. And if you just look at over age 18, it's close to 167,000. So, ideally, I'd love to vaccinate 180,000 people. Realistically, we're probably going to end up vaccinating about 80%, 85%. Both doses, so that we're looking at around, I would say, 150,000 per first, 150,000 per second, which is about 300,000, 320,000, around that. So that's what we're looking at in terms of our numbers. So we still got a ways to go, but I think that we are going in the right direction, and we will be adding clinics. So a couple of things now. Do know now with the announcements of second dose being the interval being shortened, and I do suspect that within the next week or two, there will be more age groups eligible for that shortened dose. Just to let you know that we've also, because our clinics were booked very quickly, we added a couple of thousand, and they were all booked as well. And we've got between now and June, and the first week of June, we've got over 28,000 that are already booked. And what we did is we got together with our staff today, looked at our vaccine inventory, and we've actually added 3 more clinics for starting on Sunday. There'll be a clinic added on Sunday, a clinic added for Monday next week, and another clinic added for the Wednesday on Wednesday, which will next week we will have a total of 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 clinics in a 7-day period, and so we've added 3 more, and that's over 3,200 more positions that it'll be available. We're just waiting from the ministry. We will be releasing a press release and share that momentarily those clinics will go live, so people can go and book them. In addition to that, I'm waiting. We have a meeting on Saturday with the vaccine task force, and we will get our more permanent allocations moving forward into the second and third week of July. And so we've already got clinics scheduled on paper here. We're just waiting for allocations, and then we will start adding very shortly, likely early next week, additional clinics moving into July, and then subsequently into August. We've planned these. We have these on paper, but again, these are tentatively planned until we have a definitive allocation of our numbers. And so we do believe that the numbers will go up, not down. So these are firm there, and they're over 120 clinics between now and all the way through to the middle of August, and then we got room after that as well. So I'm quite confident that we're in the right direction. A couple of other things that I just wanted to mention in terms of our clinics as well. It seems that what's been going on right now, and as you know, the numbers that I'm just predicting now are just based on our mass immunization clinics, that we also have physicians administering, hospitals administering, and our pharmacies as well. And so what we've been seeing is that people who have gotten their second dose through a local pharmacy should not forget to cancel. So because what happens is, let's say an individual had their first dose given through us and had booked their appointment through the provincial system, they automatically have their first and second dose appointment given to them 4 months. But some individuals, because they now fall under the category where they're eligible to have a shortened interval, have actually gotten their appointments through a pharmacy, and they got their second dose, but because the booking systems are not the same, they did not cancel the second booking through the provincial system, and as such, they didn't come to our clinic, so we could have used that spot. So I would please, if you get your pharmacy, if you get your second dose, let's say you got the dose from us, from our health unit, and you already had your second dose appointment and you moved it forward at a pharmacy and got it earlier, please don't forget to go online and cancel your second dose with us, because that will liberate a spot for us. Okay, so that's quite important. And again, we are also going to be receiving Moderna and Pfizer. There are some interchangeabilities. We will be able to interchange Moderna for Pfizer and vice versa if necessary, if we don't have one stock of one or the other. And as you know, there is interchangeability between AstraZeneca and mRNA vaccine for a second dose. Donc, bonjour tout le monde. Je vais vous donner un résumé des cas. Donc, ça va bien au niveau d'Ontario. Aujourd'hui, on a augmenté nos cas de 590. Hier, c'était 411, je pense, dans les 400. Mais on est toujours dans une bonne trajet. Même autour de Toronto, on voit clairement une diminution des chiffres. Au niveau de notre région, nous avons de bonnes nouvelles aussi. En effet, nous avons 12 cas actifs et un total de 4 719. Comme vous savez, comme vous avez déjà, j'imagine, vous avez observé vous aussi qu'on avait des problèmes. À un moment donné, on a diminué, je pense, 120 cas diminués. C'est une erreur du système de CCM qu'on appelle. Ça avait compté des chiffres qui n'étaient pas supposés d'être comptés. Par contre, on a tout réglé. Donc, ça reste avec les chiffres ici actuels que nous avons actuellement 12 cas actifs. Et je peux vous dire aussi, je suis très content de dire qu'aujourd'hui, on n'a pas ajouté des cas de tout. On n'a aucun cas ajouté. Donc, à peine, on a quelques cas par quelques jours, qui est une très bonne... ça, c'est des très bonnes nouvelles pour nous. Et si on voit au niveau de la carte, vous pouvez voir que dans la plupart de notre région, on n'a aucun cas actif, qui est très bien aussi. Donc, on va vers la bonne direction, à mon avis. Et c'est pour ça qu'on pourrait rentrer demain dans la première étape de découvrement, si vous voulez. Et parce qu'on est rendu au niveau des chiffres, au niveau de vaccins, on a passé le 60%, on est presque 80%. Et au niveau des chiffres, au niveau des hospitalisations qui sont diminuées dans notre région aussi et autour d'Ontario. Et aussi, nous avons des cas, les cas quotidiens, les moyens mobiles, tout ça, sont dans la bonne direction, sont dans le même niveau, qui sont à ce moment-là, c'est approprié d'ouvrir. Donc, dès demain, on commence avec les restaurants qui pourront servir les clients, mais sur le patio à l'extérieur seulement. On aurait aussi le rassemblement qui pourrait être jusqu'à 10, mais seulement à l'extérieur, pas à l'intérieur. Les magasins avec les produits essentiels pourront augmenter leur débit de 25 des personnes qui pourront entrer à la fois et les détaillantes qui vendent des choses non essentielles vont rouvrir avec une capacité de 15 donc, ça, c'est des bonnes nouvelles. Donc, deuxième étape, on va avoir plus des personnes, et ça va être plutôt à l'extérieur. Au deuxième étape, on va avoir les coiffeurs, etc., qui vont ouvrir, les barbiers, tout ça vont ouvrir aussi, ainsi que les parcs aquatiques, etc. Et sûrement, les personnes qui pourront se rassembler à l'extérieur vont augmenter. Peut-être on va avoir plus de personnes, on va avoir peut-être la capacité d'avoir 5 personnes dans la maison, etc., des rassemblements dehors de votre foyer, etc. Mais ceci est à suivre. Mais d'ici là, il faut qu'on prenne attention, qu'on fait attention pour que les chiffres demeurent bas. On ne va pas reculer. Ça, c'est très important. Et ça va nous donner la chance aussi de vraiment faire attention au niveau des vaccins, qu'on pourrait vacciner plus du monde parce qu'on a encore le menace du variant Delta, qui n'est pas dans notre région actuellement, mais on sait que ça pourrait rentrer et c'est transmissible beaucoup plus facile que les autres souches, si vous voulez. Donc, on va parler maintenant des vaccins. Encore des bonnes nouvelles au niveau de nos vaccins. On voit ici que jusqu'à aujourd'hui, puis on ne compte pas aujourd'hui, parce qu'on a deux cliniques qui sont en fonction actuellement. On a vacciné plus que 103 000 personnes. La plupart sont des premières doses. Donc, on est presque à 78,6 plus que 60. On approche le 80 et on va être à 80 d'ici samedi parce qu'on va avoir vacciné une autre à peu près 6 000 personnes au moins d'ici là. Donc, on va dans la bonne direction. Et il faut aussi que j'explique un petit peu au niveau de qu'est-ce qui va se passer d'ici quelques jours. Comme vous savez, les personnes en bas de plus que 70 ans et les personnes qui étaient vaccinées avant le 19 avril pourront aller sur ce site web pour avancer leur deuxième rendez-vous pour deuxième dose. Donc, à ce moment-là, on a eu beaucoup de personnes qui ont toutes comblé nos 28 000 places que nous avons, disponibles d'ici jusqu'aux premières semaines de juillet. Par contre, nous avons ajouté une autre 3 cliniques la semaine prochaine qui vont commencer dimanche, lundi. On va ajouter 3 d'autres dimanche prochain qui s'en vient à peu près, lundi et mercredi prochain. Donc, à ce moment-là, on rajoute plus que 3200 places qui vont être disponibles très bientôt sur le site web. Ils ne sont pas là encore, mais on les a mis. Donc, j'encourage les personnes d'aller sur le site web et prenez avantage de ces 32, plus que 3200 places qui seront disponibles, qu'on a ajoutées d'ici quelques jours encore. Il faut dire aussi que cette fin de semaine, samedi, nous aurons nos allocations plus précises, si vous voulez, pour le restant du mois de juillet. Donc, on va avoir des cliniques sûrement disponibles après le 9 juillet. Donc, aussi, découragez-vous pas, il va y avoir en masse des places. On rajoute des cliniques et on fait ça aux tranches de 3 à 4 semaines à la fois. Donc, on va sûrement avoir, en plus des 3000 plus que les 3200 qu'on va ajouter la semaine prochaine, on va ajouter pour le mois de juillet pour les personnes qui pourront avoir le rendez-vous. Donc, inquiétez-vous pas, on aurait assez de vaccins pour tout le monde nous sommes prêts à le faire le débit de deuxième dose va commencer à augmenter parce que là, on va être rendu à 80-85 de la population qui a rien reçu la première dose. Il faut dire aussi que qu'est-ce que nous voyons aux cliniques actuellement, c'est qu'il y en a des personnes qui ont déjà booké, qui ont eu le premier vaccin avec nous aux cliniques de masse immunisation, qui ont pris leur rendez-vous sur le système provincial. Donc, à ce moment-là, ils ont le premier dose pour première dose et le rendez-vous pour deuxième dose. Par contre, ils pourront, dépendant de l'âge et les circonstances, il y a plusieurs personnes qui ont booké, qui ont eu leur deuxième dose aux pharmacies avant la date prévue. Mais ils n'ont pas annulé leur clinique, le rendez-vous sur le système provincial. Donc, on a eu dans quelques cliniques des personnes qui ne sont pas présentées parce qu'ils étaient déjà vaccinés aux pharmacies. C'est une bonne chose. Par contre, je vous prie, si vous êtes dans cette circonstance et vous avez reçu votre deuxième dose, mais vous avez eu encore votre rendez-vous avec le système provincial, d'aller sur le site web, d'annuler ce système. À ce moment-là, ça va libérer les places. Donc, je vous prie de collaborer dans ce sens. Autre chose au niveau des vaccins, il faut dire aussi qu'on peut commencer à faire la changer. Autrement dit, disons vous avez reçu votre première dose de Pfizer, on pourrait vous donner une deuxième dose de Moderna si on n'a pas de Pfizer et vice-versa. Et la même chose aussi, si vous avez reçu votre première dose d'AstraZeneca, on pourrait vous donner votre deuxième dose soit avec Moderna ou Pfizer. Donc, bonne nouvelle, les chiffres vont dans la bonne direction. Au niveau des cas, ça diminue. Au niveau des vaccins, ça augmente. On veut que ça continue. Donc, mais il faut aller doucement avec le réouverture, de déconfinement, si vous voulez, de notre région. Donc, on a pas mal de bonnes nouvelles, mais il faut continuer. Je suis pas mal sûr qu'on va y arriver. On va arriver avec beaucoup plus de normalité d'ici fin août. On prévoit avoir vacciné le maximum qu'on pourrait. On a 180 000 personnes âgées plus que 12 ans. Donc, je préfère vacciner tous, mais on ne peut pas. On peut pas. Je ne pense pas qu'on va y arriver, mais même à 80%, 85%, on va vacciner 2 fois 160 000 personnes à peu près. Déjà, comme vous voyez, on va être à 140 bientôt. Donc, avec le débit de vaccins qu'on va recevoir, je pense qu'on pourrait le faire. Juste pour clarifier, on a 180 personnes plus que 18 ans. Plus que 12 ans, je m'excuse, et 167 000 personnes, des adultes, 18 ans et plus. Mais le chiffre qu'on veut, c'est le ciblé, c'est le 180, et on voudrait vacciner 2 fois un pourcentage le plus haut dans ces 180 000 personnes. So I got some questions here. I want to remind people, so I clarified that. I've also clarified, I had a question here about the number of people that we want to vaccinate. I've clarified that as well. I know that our dashboard now has first and second dose percentages. We will actually be keeping more of an eye on that and giving global percentages as well, because we've got second doses, and most of those are in retirement homes that we've given that are now on our website. And that's it. The other questions I've answered. So, Jenna.
Thank you, Dr. Paul. Merci. Notre première question, Denis Babin, Radio-Canada. C'est à vous.
Bonjour, Dr. Paul.
Bonjour, Denis.
La province, Dr. Paul, permet à ceux qui se sont fait vacciner ailleurs qu'en Ontario, par exemple au Québec, d'avertir leur bureau de santé afin d'être inscrits sur la liste. Mm-hmm. Est-ce que présentement, il y a de l'information à cet égard sur le site du bureau de santé?
Non, parce que le programme a été mis en place je pense, hier, et on est en train d'avoir les procédures en place qui pourront simplement avoir une preuve de vaccination en dehors de Ontario, qu'on pourrait le mettre sur nos sites, que nous, on va l'entrer dans le système pour que ça soit enregistré comme une personne vaccinée. Donc, ça s'en vient. On a eu une mise à jour lundi que le système est en train d'être placé, mais il y avait encore un peu d'hésitation parce qu'on n'avait pas encore la capacité parce qu'on a besoin d'une preuve électronique, si vous voulez, qu'on pourrait télécharger sur le COVAX. Mais ça s'en vient bientôt, puis on va faire une annonce dans cet égard.
Donc, c'est une annonce qui pourrait arriver la semaine prochaine?
Oui, oui, oui. On se fait dire que ça va être prêt le 7 juin, mais on a passé. Donc, ça va être, je pense, bientôt. On va avoir des nouvelles samedi dans ça.
Merci beaucoup.
Pas de problème, Denis.
Next question, Philip Blanchard, Morrisburg Leader. Please go ahead.
Hi, Dr. Paul.
Hi.
So the first question is about the data issue.
Mhm.
You said that certain filters were applied or not applied. So you're
Yeah.
saying the issue is on the province's end for reporting, or was that an EOHU error in not using the right filters?
I think the CCM, we're looking at that now. The CCM, for some reason, looked at other parameters and misinterpreted them and put them in. We were using the same filters all along, and then all of a sudden it happened. So we're not sure what happened, but at this point we've corrected it, and moving forward, those are the accurate numbers.
Okay. And at what point did the cases really start to fall off in this third wave then, if the data set is different? I mean, we saw cases get changed around and the number of active cases drop.
I know. I believe that the numbers started going down, and just looking at the real additions, probably I would say a couple of weeks ago when we started that with one weekend where we had very minimal cases. So it's been about a 2 or 3 week trend that we're seeing it go downwards. And we've been seeing it anyway. We've been seeing it because we know what the sense is of the daily cases. We know when they come in. So
right. Okay. And so that your numbers for vaccines given,
Mhm.
that's how many the EOHE region has administered. Okay,
Yeah.
that's how many you administered in the pharmacies and so on.
Yeah.
That's not actually the number of people who live in the EOHU, because you do have people from EOHU who go outside of the region for vaccines,
Yeah.
and you do have people that are booking from Ottawa, booking
Mhm.
in this area.
Mhm.
So what's the actual number of people vaccinated in the EOHU, like EOHU residents?
it's actually pretty close because we looked at the numbers and we get those data, and we have data of the ministry data is actually pretty close to ours. What happens, it kind of works itself out because we know reports, like, for example, I know that Ottawa Public Health delivered so many to our residents, and then vice versa. And the correction is, so when the ministry gives us the numbers, it gives us based on our postal codes, and they're pretty close to what we have. So it actually irons out, it works out.
Okay. And lastly, because beaches are opening up and public pools are going to be opening up and so on, the UHU is throwing a lot of its own resources into getting the vaccinations out the door as quickly as possible, in part to stem the tide of Delta variant. So what about other EOHU services like the water testing? Is that being ramped up? Or
Water testing started 2 weeks ago, and it's ready to go in anticipation for this. Our public health inspectors are working with municipalities with the pools, and we have already given guidelines and other information for how municipalities can operate their beaches and so on. Yeah, so we saw this coming, and so our public health inspectors are reserved for that right now.
Okay, great. Thank you. Have a good weekend.
No problem. You too.
Next question, Bill Kingston, Newswatch Group. Please go ahead.
Yes. Hi, Dr. Paul.
Hi, Bill.
Hi. I wanted to ask you, the federal government announced that the people that return from travel who are fully vaccinated don't have to quarantine.
Yeah.
You have people that you've said before that are, if they have the first shot, they're protected. The chances of getting it are 0.04% of getting COVID. Given the finickiness of the provincial website, people that have had their first dose and had their second dose appointment is 4 months ahead. We're hearing a lot of people that say, there's no advantage for me moving up my dose because I'm under the same restrictions that the rest of the community is. What do you say to those people? Why should they bother moving their dose up than the 4 months that it's away?
That's a good question. I got a good answer for that, because the quicker we get not only is it that first of all, I want to correct you. The first dose will protect you probably 80% something like that for everything. It'll prevent hospitalizations and death, and for the most part, it'll protect you about 40% to 45% for the Delta variant. So the reason that we want to push it is that we want to prevent the Delta variant, because the second dose prevents it at a higher rate. However, the good excuse to me is that the quicker we get second doses in at a high enough level, we'll be able to get rid of the masks. We'll be able to open up more. We'll be able to. I call it the key to opening up. So that's why. So I think people who are hesitant there or say there's no advantage, yes, there is an advantage. The quicker we get the second doses into people, the quicker then we can go like beyond step 3, because step 3, as you know, has a 25%, second dose, which to me is achievable easily, because we'll be at 20% very soon. I believe that we'll be at 75, 80% by the end of August. And so you can imagine that, I'm already looking at, Bill, kind of what we're seeing, what life will be at that point. You can get together without masks. You can hug people, you can get, under certain circumstances. So we'll be able to go to hockey games. We'll be able to go, to do all these things. So I think this is the key to going back to normal, in addition to offering the protection from the variants and more solid protection, with a second dose, which will likely be long lasting. So there are a variety of reasons, notwithstanding travel.
Yeah, I guess we're just hearing a lot of people that are exhausted and they think, well, I finally got my appointment. I don't want to play around with it for the fact that
I understand. But we're going to be when I'm looking at the numbers, there will be opportunity for people to get, to get their second dose. It's worthwhile doing it because, like I said, the quicker we get there, the quicker we can return to normal.
Right. Okay.
All right.
Just a quick follow-up with the corrections in the data. Did it change at all the R naught and positivity?
No. Our R naught is around 0.75, 0.8. And our positivity is 1.5%. I don't remember the exact number. I can actually tell you that in a second. I've got it here.
The last time we talked, I think you said 0.78.
Yeah, I don't remember what it is. Hold on. I'm just going to a quick. There's a website that I have here that I access. Right, they can give that to me almost instantaneously. Okay, so Eastern. Yeah, our R naught is 0.9 now, actually, but yeah, it's 0.9. And our percent positivity is 1.3%.
1.3%.
Yeah.
Oh, and a quick thing. Have you had your second dose?
Yep.
You did. Okay.
I just had it.
Perfect. Thank you very much.
Okay. Thanks. Yeah. And I encourage everybody else to do so when the turn comes up, but it's, I do anticipate, Bill, that when we have, I want people to understand, Bill, if you do me a favor, and others on the media listening, really the crux is we want to be able to get people vaccinated as soon as possible. Again, yes, we are worried about the Delta variant, but the bottom line is that this is really our ticket to a much normal fall and a much normal winter than we had before. Let's put it that way. It won't be 100% normal. I'm not going to guarantee that because we're still going to be living in a pandemic. We're still going to have ups and downs, but it'll be much more normal. I'm looking at some of the guidelines that the CDC has put out, some of the stuff that we're doing with masking, and it really, you see games. I think it's a bit premature, but you've seen hockey games now in the States, people in the stands. We're getting there. We're getting there as well, but we need to be vaccinated twice.
Thank you.
Thanks, Bill.
Next question, Natasha Wood, Nation Valley News. Please go ahead.
Hi, Dr. Paul.
Hi, Natasha.
You said you have scheduled 3 clinics for Sunday, Monday, and Wednesday. Can you tell me where they are?
Yes, I can. One is in, hold on. One is in Castleman. One is in Castleman. One is in, the one on Sunday is in Castleman. The extra one on Monday is in Cornwall. And the extra one on Wednesday is in Rockland. But that's in addition to what we have. So we have more. We actually next week we have 13 clinics. So
okay,
these are in addition though.
Thank you so much. Have a great one.
You too.
Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you very much. Merci.